Good evening, students. Last week, we treated the assessment of patients with respiratory disorder. And I promise you that this week, we will start in disorder proper. So the bold heading there is going to be management of patients with respiratory disorder. If you are not forgotten, when we reviewed the anatomy and physiology of respiratory system, we first of all talked about the upper respiratory tract and the lower respiratory tract. So this evening, we're taking the first condition. The condition I'm going to talk about is a very common condition that almost everybody have suffered it. That is the condition that is not generally, people call it common cold. But for the purpose of this lecture, I don't want to stop at the definition of it to be a common cold. I call it coryza. And the spelling of coryza, you either spell it this way: CHORIZA, or CORIZA. Another name for it, you call it rhinitis. And rhinitis is spelled as RHNITIS, rhinitis. Whether you call it rhinitis, or you call it coryza, or you call it common cold, we are talking about the same condition. So this condition, as I've said, is also called common cold or acute coryza. It is an infection of the upper respiratory tract. As I've told you, at the time we reviewed the normal anatomy and physiology of it, we started, but first of all, talking about the upper respiratory tract. This condition, coryza, common cold, rhinitis, it is being caused by varieties of virus or viruses. You know how we have over 200 varieties of viruses, and each of them are bound to cause this common cold. But the three major types of viruses that is very common in our environment are A, rhinoviruses, B, coccidioviruses, and C, adenoviruses. Those are the commonest ones that can be found within our environment. It will interest you to equally note that we have a type of rhinitis or a type of coryza or a type of common cold which is not caused by the virus. Just like an asthma, your body can just react to any foreign agent. And because of that, we might have read or seen it in textbook where it is written allergic rhinitis or allergic cholera or allergic common cold. So the way the body responds, and an individual is often seen to have asthma. You could have common cold by reacting. You can even react to food. It's seasonal sometimes, all this maize, granules. For me, if I eat the first corn when in season, I will get common cold. That type of common cold is an allergic one. It's not a common cold that is caused by any virus. When this viral infection enters into the body, what are some of the signs and symptoms? One experiences runny nose. That is water, fluid, liquid coming out of the nasal cavity. Not only that, the eyes will be watery. Tears will equally be coming out of the eyes. The nasal cavity is going to be congested because of too much fluid. The patient will be sneezing often. There's going to be cough. He or she may equally complain of what? Sore throat. Sore throat. There's going to be headache, fatigue. That is tiredness. And above all, the temperature is going to be elevated. Even when the condition is not yet complicated by the secondary infection. The temperature is going to be higher than normal. We refer to that as an altered temperature. This viral rhinitis or viral cholera have got a number of complications. And that's why we need to be very careful. Once you have that condition, do what you're supposed to do to make sure that the condition leaves you as soon as possible. If not, at the end of it all, you will suffer its complications as follows. 1. Pharyngitis. Pharyngitis means infection and inflammation of the pharynx. Pharynx. If you are not forgotten, I told you that the pharynx is a common junction for the food that we are eating, common junction for the air that we are breathing in. So the infection and inflammation of the pharynx is what I'm calling as pharyngitis. So pharyngitis could be a complication of viral rhinitis or cholera or common cold. Sinusitis could be the second complication. If you don't suffer pharyngitis, you may have to suffer from sinusitis, or you may suffer from all, including others that I have not even mentioned yet. Sinusitis is equally infection and inflammation of the sinus. Sinuses are just spaces, tiny spaces, minor spaces that are found within the upper respiratory tract. Once it is infected, it becomes inflamed. And the inflammation of these sinuses is what I call sinusitis. Otitis media. This is an infection and inflammation of the middle part of the ear. The middle part of the ear. Tonsillitis. This is an infection and inflammation of the tonsils. Tonsils are found at the upper part of the mouth, and there may be lung infection. Let me just use 1 minute to tell you the reason why an individual has common cold may later on suffer from otitis media. When you look at the diagram of the ear, not the outer part, not the inner part, but the middle part of the inner ear. There are 2 openings. Each of the openings is coming from the middle ear down to the throat. That space I told you, and I refer to it as to be the common junction, there are about 7 openings into the pharynx. 7. 2 from the 2 ears, 2 from the nares, 2 plus 2 equals to 4. 1 from the mouth, 1 plus 4, 5. 1 opening to the esophagus, 1 plus 5, 6. 1 going to the trachea, 1 plus 6 equals to 7. That opening that comes from the middle ear contains nothing but the air. Part of the air you are breathing in, you pass through it. So, an ascending infection, something going up. Because from the pharynx, we expect the infection to go up, not to come down. That infection that travels through these 2 openings into the middle ear will set up an infection and inflammation of the middle ear. And ordinarily, the inflammation, infection of the middle ear is what we are referring to as the middle ear. And you can see the reason why that person that suffers common cold or suffers rhinitis, later, if it's not properly managed, you could suffer from otitis media. Some of the nursing problems that somebody having rhinitis could present, they are as follow. He or she suffers from knowledge deficit. Knowledge deficit in nursing, it means that individual is not having adequate knowledge about the causes, how he managed to get the rhinitis or coryza or common cold. 2, the body temperature is going to be altered. Altered in the sense that temperature becomes higher than what it's supposed to be. If the normal body temperature is supposed to be 37.2 or 37.4, whoever has viral rhinitis or acute coryza, the temperature may go as high as 38 or 39 degrees centigrade. That patient may not be able to tolerate any form of activity because of tiredness of the body. It's having tiredness of the body because of the activities of this viral infection. In fact, viral infection makes the body weak. And once the body is made weak, that individual may not be able to tolerate activities of daily living. For example, you won't be able to bath the way it's supposed to be, oral hygiene, you won't be able to eat well. Those will pose some challenges to any nurse that is taking care of a patient having viral coryza or viral rhinitis. Another nursing problem is high risk for infection, which means that patient's body is potential to any form of infection, especially the complications I mentioned before, including those ones that I have not mentioned. The infection may travel up and may come down. Come down is going down to the lungs. And by the time you allow the lungs to equally be infected and inflamed, that patient suffers a sort of pneumonia. From viral pneumonia becomes bacterial pneumonia, or may have lung abscess. That infection went into the ear. It may not stop there. The virus could penetrate to even affect the brain, part of the brain. Because the brain is said to contain some membranes. The membranes covering the brain, they are referred to as meninges. If you allow the meninges to be infected, the patient suffers meningitis. And once the meninges are involved, the tissue of the brain, it gives rise to encephalitis. Those are some of the infections. So there's high risk for infection. And for you to retard or to prevent this high risk for infection is to manage the patient as early as possible before any complication arises. There is primary infection. It's a nursing problem. In fact, for information, there's no difference between nursing problem and nursing diagnosis. All those things I mentioned, they are all forms of nursing diagnosis that we must endeavor to manage when it comes to manage somebody having acute rhinitis or acute coryza or acute common cold. These nursing problems should be resolved using the nursing process approach. Yes. The 5 diagnoses that you may have more than 5, but not less than 3. It could be 3, it could be 4, it could be 5. At a time, you cannot identify more than 5. Let them be in categories. Category A, you've identified 5 nursing diagnoses. The approach you are going to use in managing these 5 nursing diagnoses is to use the nursing process approach. A nursing process approach, that is the approach used by the modern nurses to resolve the patient's problem. Before this period, nurses manage patients not necessarily using nursing approach. They just manage for purpose of managing. And if you ask them, that the aspect of management, how does it work? They can't tell you anything. But whoever is using nursing process, managing any condition, ask him or her, and he'll tell you the reasons why what he did has assisted in resolving the patient's condition. And the nursing process you are going to use equally has the following 5 aspects. 1, you diagnose. You call that one nursing diagnosis / nursing problem. If you don't call it diagnosis, call it nursing problem. Number 2, there must be nursing objective. By the time you have a diagnosis, what do you want to do to, for example, one of the diagnoses of this patient is that the temperature of the body is altered, where the body temperature is higher than normal. The question now is what to be your own objective towards that temperature that is higher than normal. Someone may say, well, I will expect the patient temperature to reduce by at least half degree, or 1 degree, or 2 degrees after 3 hours of an effective nursing management. That may be somebody's objective. Number 3, the nursing intervention. Nursing intervention will be what will you be doing to make sure that patient's body temperature reduces. Someone will be saying that he or she is going to nurse that patient in a well-ventilated environment, the ward that has adequate ventilation, open the windows, open the fans, don't cover the patient with a thick blanket. And somebody will be saying that, whether I'm going to give the patient a cold drink, water, or somebody will be saying that I'm going to tape a sponge the patient's body. Whatever action you do that will help in reducing this body temperature is agreed. Just one activity alone may not enable you to achieve the objective that you set for yourself. Don't forget, the objective you set for this altered body temperature was that within 2 hours of an effective nursing management, you expect the patient's body temperature to reduce at least by 1 or 2 degrees. That's the objective. And under intervention, whatever you think you can do in life to make sure that this patient's body temperature reduces by 1 degree or 2 degrees within 2 hours of the necessary nursing intervention, you do it, including even the drugs that is going to be ordered by a doctor. Because as you know that in nursing process, there are 3 activities. Those activities must come into play. There are going to be things you are going to do. You don't wait for anybody to tell you to do it. We call those ones independent activities. For example, you don't wait for anybody to tell you to nurse that patient in a well-ventilated environment. You don't wait till the doctors come to tell you that, look, go and apply cold bath or give the patient cold drink. Then there are other activities that you depend on doctor and doctor depend on you. That one comes under interdependent activities. You depend on him and he depends on you. And finally, there are some activities that you do to reduce this patient's body temperature, which is mainly dependent. You can't write anything because you are not trained to write drug for anybody, but you are trained to administer. If you are trained to administer, wait until the drug is ordered. It's only the nurses that doesn't know what they're doing. That you have a patient with an altered temperature, they don't know what to do. They're waiting for doctors. I would say shame. Shame in the sense that there are a series of nursing activities that you can do to reduce the patient's body temperature. Number 4, part of nursing process, scientific rationale. What is the rationale behind you applying cold drink or cold bath to this patient? Through radiation, convection, evaporation, the heat will evaporate. Nurses of yesterday doesn't know that. All what they know is if I bath the patient in cold water, that's all. How does it work? You as a nurse must be able to state it. So the reason why that thing works is what we're referring to here as the scientific rationale. And lastly, under the nursing process approach you are going to use is the evaluation. You'll be evaluating the objective you set. Don't forget, let's go back to that objective. I said that the patient, within 1 hour or 2 hours of nursing intervention, his or her body temperature reduced by at least 1 degree or 2 degrees. So therefore, in the evaluation, you look, after your nursing intervention, the patient's body temperature reduced by 1 degree, or does it reduce by 2 degrees, or it doesn't even reduce at all? It is very possible that after nursing intervention, nothing happened to the degree, it didn't even reduce at all. Don't be a liar. Don't be nurses that tell lies. say something factual, what you are seeing. Yes, in my evaluation, at the end of 2 hours nursing intervention, temperature did not reduce. The temperature did not reduce. I mean, the temperature reduced, but how much does it reduce? Is it half degree? Because you expect the temperature to reduce between 1 to 2 degrees. Now you are not evaluating. And you found that temperature reduced by just half degree. Whatever a degree that you see, right in there. That shows that yes, your nursing intervention is working, but the objective set is not yet achieved. Next on the topic to be discussed is nursing / the medical management. You are going to have nursing / the medical management because you cannot totally rely on the nursing problem or nursing diagnosis or using nursing approach or nursing process approach to resolve this patient's problem. Because you are told from the beginning that most of the viral infections, they are difficult to manage. Difficult to manage in the sense that viral infection, they don't have enough specific drug to go against the viruses. Bacteria has a lot of antibiotics, a lot. So you may resolve into using what I refer to as the interdependency. You depend on doctor, doctor depend on you. So many drugs will be written. So many sprays will be written. And once they are written, you have to make sure that the patient uses them. So intervention of nursing and medical management, they are directed towards relieving the patient's symptoms. And that's why some of the books we are going to read, they will tell you that any viral infection is very difficult to treat. If they're difficult to treat, what can I do? Okay, let me just manage them symptomatically. If your nasal cavity is congested, decongest it. So the first thing I'll talk under this management is rest. Adequate bed rest will relieve the patient's problem of activity intolerance. I told you the series of activities of daily living that this patient cannot do. Why? Because the body is too weak. And once your body is too weak, there's nothing you can do. To eat is going to be a problem. To bath is going to be a problem. Oral hygiene is going to be a problem. In an acute stage, in fact, the patient will depend on you, the nurse, to make sure that you are assisting or her in his or her activities of daily living that he cannot meet. You meet for the patient, but don't be carried away. As you are meeting the activities of daily living for this patient, be watching. Because if the patient is not what he or she was yesterday when he came, today he has improved. Tomorrow is going to improve more than today. But next tomorrow is going to improve more than tomorrow and more than today. So that at a time when you come to realize that some of these activities, I think the patient cannot do it. Let the patient do it while you supervise or you pass an instruction on what to do, by providing him with what he or she is going to use. The reason is that patients equally are human beings. By the time you are thinking that everything I need to provide it to this patient, are you going to follow the patient home? Because what the patient requires from you as is going to be discharged is instruction. And that instruction that we are referring to as health education. What will he or she do in the morning if she gets up? If you don't allow the patient to learn how to take care of himself, then you are creating more problems. Because very soon that patient is going to be discharged and he is going to meet his own activities of daily living. So the basic activities the patient could not meet shall be identified and carried out for him or her. Pulmonary infection, which is actual, coryza, common cold, rhinitis, is actual. Since it's actual, things could be done to make sure that you resolve that equally. Because if you don't resolve that, all the symptoms and signs will persist. And before you realize, by next week, the patient is down again with secondary infection, which I refer to here as complications. Don't allow that to happen. So some drugs may be ordered. For example, antipyretics. I didn't say antibiotics, because antibiotics will not work for somebody having viral infection. But that individual that suffers the viral infection has an altered temperature. And in addition to what you've been doing, that you are going to nurse that patient in a well-ventilated room, drugs could be ordered. You are not to write the drug, doctors write the drug. And when the drugs are written, it's your duty to administer the drugs. Antipyretics, or in some cases, analgesics. Analgesics are pain relievers. And whereas the antipyretics resolve the problem of a high temperature. Where these drugs are ordered, it is your duty as a nurse to make sure that all these drugs that are ordered, they are given. I talked about the sore throat as part of signs and symptoms. Sore throat can be dealt with. Relieve that symptom of pain by doing mouth gargling with warm water. Put small salt inside it. I'm not saying you should tell the patient to drink it. It's not drinking. Gargling. Or pour away. Or pour it away. Or pour it away. If you don't tell the patient that it's just gargling, before you realize 1 minute the patient has taken a lot of salt. You've been fighting at that condition. Let's assume that patient has the tendency of having a high blood pressure. Now you are not pushing salt into him or her. So it's mouth gargling. Don't allow the patient to drink the salt water. So warm salt water is used for gargling. Lozenges. These are some of the drugs that the patient may be leaking. It equally is the sore throat or to alleviate the sore throat. There could be some nasal spray which is going to reduce the nasal congestion. Spray. Just like that spray that is used by the asthmatic patients. But this spray is the spray that is used to decongest the nasal cavity or the nares. Antihistamine and the congestant therapy reduces the patient's nasal drip. And significantly, reduces the severity of the cough equally. If the cough is also so productive, you have some cough syrups that encourages the formation of sputum. Treat the patients to manifestations of secondary infection. Because the patient is coughing, You cough out something. What is coughing out? Look at it. Is it pulling? Is it smelling? Is it having color? Don't just allow the patient to bring that sputum and throw it away. No. Well, the container we want to use as a sputum mug. Sputum mug can be used while the patient is asked to put the sputum inside it. If because we want to see the content of what is coming out of the patient that is being referred to as the sputum, you want to find out if actually there are manifestations of secondary infection already. Because in situations where a patient suffers secondary infection, the sputum will not look clear at all. It will change color. You will smell it. It's going to be very purulent. That will be the essence. So teach the patient to recognize the manifestation I said of the secondary infection. For example, high temperature, tenderness, swollen glands, pain in the ear because of otitis media, purulent nasal drain. Secondary pulmonary disease will lead to the following signs. There are going to be a change in the consistency of the color and volume of the sputum. Other signs include shortness of the breath, that is difficulty in breathing, tightness of the chest. Measures such as frequent hand washing should be done to avoid frequent hand washing and avoid overcrowding. Because if you could tell your own story, yes, I live in the same room with somebody that suffers common cold, and I was not surprised myself pick it. As you pick it, you can equally pass it to others. So avoid overcrowding. If you avoid overcrowding, you will be preventing the spread of this infection. Equally, avoid hand-to-face contact. The first part of our organ that we use is using the infected hand. You use it to rub anywhere, rub your nose, rub your face. And by the time you pick up this virus, you rub your nose, it will go in. So avoid touch or rubbing your face frequently, especially knowing fully that you have somebody adjacent to you that suffers common cold. Equally, all nursing measures necessary for reducing the altered temperature should be seriously considered. For example, nurse patients in an airy environment, giving cold drinks, tepesponging. So, if we do that, as I've said, through radiation, through convection, through evaporation, the patient body temperature will reduce to its normal. That is all what I have, students, for this evening's lecture. Next week is going to be another week. We will consider another condition. I expect all of you to go and read common cold and its management. If you have time, read about the allergic coryza or the allergic rhinitis. So at the end of it all, you'll be able to filter out the differences that exist. I call it a day. Enjoy the remaining part of your days.